Okay, so this is SOT protocol for Category 2. First thing we need to do is establish our short leg. We do this with the patient supine, cup the legs, look for the at the medial malleolus, and our patient has a right short leg. That's going to be the side that we do our arm fossa test on. So if you could raise your arm up, make a fist for me. We're going to test both poles. So the upper pole comes back strong, lower pole comes back weak. So we need to do our congruency test with an upper pole weakness that would correlate to a medial knee pain on the involved side on the short leg. And then with a lower fault, we have lateral pain on the long leg. So is that tender? Okay. So we have the congruency that we need. Next thing we need to do is get the patient blocked. We do this by having them bend a leg and then rotate over. This is assisted by the patient. First block goes in perpendicular to the spine, riding the iliac crest, half on and half off. The second one that we do, flex your knee, roll it towards me please, is this goes under the acetabulum at a 45-degree angle pointing superiorly. Now we leave them here for up to 2 minutes, but we need to reconfirm that we've done the right thing and make sure that neither of these go weak. Assuming that they are in the right place, we can move on to our augmentation protocol. The first thing that we can do is we can readjust the blocks to make sure that they're where they need to be, maybe get better results out of that. The next thing that we can do is put bilateral pressure on the patient's thighs, A to P, for 10 seconds. The next that we can do is a diagonal pressure, lower on the involved side, higher on the ASIS of the involved side, or uninvolved side. And then we push A to P again for up to 10 seconds. And the fourth thing we can do is check for a cranial fault out of basic 2. So the patient's going to make another fist for me. We're going to have her inhale all the way, fingers on the pole and chest, and she comes back strong there. Now exhale all the way fully, and we will check again, and the patient is a lot weaker. So she has an exhalation fault. What this means is that we need to come in, we need to cup underneath the patient's occiput with the left hand, put our right hand on the frontal bone, and as she inhales for an exhalation fault, we are going to put an I to S pressure on the top of her forehead. Now when she inhales, there's a few things she needs to do. She needs to touch her tongue to the roof of her mouth, and she also needs to point her toes towards me. So here we go. Go ahead and inhale fully for me. We're going to do an S to I pressure, and exhale, and we relax. So now that we're done with this, we can go ahead and we can remove the blocks. Or no, before we do, we need to lock that in with a reverse arm fossa test. So instead of pulling this way, we're going to have the patient push as we apply pressure. Once again, we're going to lock that in and make sure that we've done the right thing. Now, we can remove the blocks. Go ahead and lift up for me. And once we have the blocks removed, we do our short leg and long leg protocols. Now what we do here is we take the leg, and then we go lateral, flex it, and then bring it back to its starting position. So up and out, and we do this 3 times. And then on the uninvolved side, we do the same thing, but we go medial to lateral, and then drop back down. We do this 3 times. And then the last thing that we do is our sacral cupping. So if you could flip over for me, please. Now the way we test to see if this is indicated is we have the patient raise one leg about 30 degrees off the table, and then we apply a downward test, a downward force, to check to see if that leg goes weak. Do it on the other leg as well. Raise up for me. And she is decidedly weaker over there. So what we need to do is we need to come in and check both poles of the sacrum, and we do a pressure test. Go ahead and raise your leg again for me. We do a pressure test first on the upper part of the sacrum to see if that helps it go stronger, and yeah, she's a lot stronger. And then just for conversation's sake, we'll try the lower side, and she goes completely weak. So the way that we would correct the sacral cup is we take on the upper pole of the sacrum, we take an A to P pressure, and we just apply a pressure on it for up to 10 seconds, and then we would recheck to make sure that we did the right thing. And that is Category 2.